Is my penis normal and can I make it bigger? Can you actually change your penis size? Is it truly safe to try, or are the deep-seated worries you're carrying about your anatomy completely unfounded? At international medical conferences, practitioners from every corner of the globe report the same thing. This is a universal human experience, but as a clinician, I prefer to term the word average over normal. Everybody is unique, and normal suggests there's a right or a wrong way to exist. According to the International Society of Sexual Medicine, the average length for a flaccid penis is 8.8 centimetres, 3.5 inches, and the average erect length is 12.9, 5.1 inches. Interestingly, a major study in the British Journal of Urology involving over 15,000 men found that while 85% of partners are perfectly satisfied, 55% remain unhappy with their own penis size. This gap between perception and reality is what we call small penis anxiety, a specific form of dysmorphic disorder where the distress is psychological, even when the anatomy is perfectly within the average range. If you are struggling with this, there are 4 clinically recognised evidence-based pathways. At Restorative Health Clinic, we always recommend exploring them in this specific order to ensure your long-term health and safety. Pathway 1, psychological reframing. This is the gold standard. The most effective treatment for many isn't physical, it's cognitive. Working with a specialised psychologist to reframe body perception has allowed many of our patients to regain their confidence and realise they don't actually need physical intervention. When you treat the anxiety, the anatomy stops being the problem. Pathway 2, clinical traction devices. If a patient is committed to physical change, we look at penile traction therapy devices like the RestoreX. You apply controlled, gentle stretch over several months. A 2023 study indicated that consistent use, 30 minutes a day for 6 months, can result in a gain of around 2 centimetres. However, this is a massive time commitment and requires strict clinical supervision to avoid complications like bruising or localised numbness. Pathway 3 is non-surgical fillers. For those looking to increase your girth, medical grade fillers using hyaluronic acid is a non-surgical option. It is vital that these are performed by a qualified medical practitioner. The results aren't permanent and do require regular maintenance. And if it's done incorrectly, it can lead to swelling and irregularities in the way your penis looks. Pathway 4, surgical intervention, the high-risk path. Finally, there's elective cosmetic surgery, such as cutting the suspensory ligament. As a nurse practitioner, I do not recommend this. The risks, including instability and permanent scarring, are high, and patient satisfaction rates are historically very low. These procedures are often irreversible. Understanding your options is the first step toward regaining your confidence. If you're ready to prioritise your sexual health, we offer private telehealth consultations at Restorative Health Clinic. It's a simple expert checkup to ensure you're on the right path. You can find the booking link in the description. And now let's take a look at a real-life example of someone who'd got his confidence back. David came to us convinced he needed surgery. He had spent years obsessing over his measurements, which had caused him to pull away from dating entirely. David's clinical protocol. Step 1, the assessment. We first performed a clinical measurement and confirmed he was well within the average range. Seeing his own data compared to the 15,000-man study was David's first light bulb moment. Step 2, integrated therapy. Instead of surgery, we referred David to a psychologist specialising in male body dysmorphia, while simultaneously starting a protocol of vacuum therapy, not for size, but for penile health and tissue oxygenation. Step 3, the outcome. After 4 months, David didn't have a bigger penis, but he did have a very different life. By treating the anxiety, he was able to return to dating. He realised that his value wasn't tied to a number, but to his presence and confidence. The bottom line is this: you don't drastically change your anatomy you were born with without significant risk, but you can drastically change how you feel about it. At Restorative Health Clinic, we believe the best solution comes from treating the mind and the body as one. If David's story or the facts we discussed today resonate with you, remember, you don't have to carry this anxiety alone. And to understand how to maximise your overall erectile health and function, watch this essential video next. See you there.